To the Naho Speaker Series exploring HPV in First Nations, Inuit, and Métis communities. I would like to acknowledge that this meeting is being held today on the traditional territory of the Algonquin peoples. And on behalf of the National Aboriginal Health Organization, thank you for joining us today. My name is Colleen Patterson, and I'm the Senior Communications Officer at Naho, and I'll be your MC. Our speaker series today, as you know, will focus on research and findings related to the burden of HPV disease in Nunavut and HPV infections among Manitobans and Manitoba First Nations. These presentations will be delivered by Dr. Isaac Sobol, Chief Medical Officer of Health for Nunavut, and Dr. Alain Demers, Public Health Agency of Canada. Resources specific to HPV, Aboriginal women, and Indigenous populations will be presented by Martine Dubec of First Nations and Inuit Health Branch of Health Canada. And unfortunately, Dr. Gayatri Jayaraman has been called to tend to a family matter, so presenting on her behalf will be Stephanie Totten of the Public Health Agency of Canada. Today we are going to hear introductory remarks from Dr. Paulette Tremblay, the Chief Executive Officer of Naho. For those of you who are unfamiliar with the National Aboriginal Health Organization, our mission is to advance and promote the health and well-being of First Nations, Inuit, and Métis through collaborative research, Indigenous traditional knowledge, building capacity, and community-led initiatives. Without further ado, it is my pleasure to introduce to you Dr. Paulette Tremblay, who is a Mohawk Turtle Clan from Six Nations of the Grand River in southern Ontario and a veteran who served during the United States Navy during the time of the Vietnam War. Dr. Tremblay holds Doctor of Philosophy in Education and a Master's of Arts in Education from the University of Ottawa.
Sago, Scano. Good afternoon, everyone. Welcome. So pleased to see you out today. And I think this topic, HPV, cervical cancer, is such a crucial one at this time in our history, with so many of our people being young, half of our peoples being 25 years and younger. It's critical that we get the information out and that healthcare providers indeed understand the issues so that they can share the information, and then preventative programs can be take root in the communities so that people can make a difference and we get improved health outcomes. And that's what this is all about for First Nations, Inuit, and Métis. I'd like to welcome you here on behalf of our Board of Directors and the staff of Naho. And again, I want to give thanks for being on Algonquin territory, which is our tradition to give thanks. We do come to work every day in this beautiful territory, and when you look out at the river and the beautiful trees turning colors, it inspires us, it stimulates us, and it reminds us in this jungle of cement when we come to work that there are trees and that there's water and there's rivers, and we give thanks for being part of nature, because part of my teachings as a Mohawk from Six Nations is that we're connected to everything and we're just a small part of human beings of the whole picture, and that we have to give thanks for all of the parts, and we also have to give thanks to the spirit world and for those who came before us, because we're building on their shoulders. We also have to be mindful of the generations who are going to faces yet unseen that are going to follow us, and we want to make their journey easier and healthier. And so, I think we forget that. You know, I want to share this with you. It's just, spontaneous. We had visitors from Guatemala today, Dr. Lima, and she was talking about the conditions in Guatemala and how dreadful they are, and how their peoples have been killed and not supported, and having no health information, and they live in the mountains and no health services, and birthing happens in their mud huts, and it's they have high rates of death. And when I remember that, she came in wearing her traditional attire. And she said that everyone that works in Guatemala comes to work with their traditional regalia. They wear it, and in communities they wear it. It's like saying who we are and where we belong. And if they're not in their full dress attire, they wear at least the jewelry from where they come from. And I thought, well, gee, you know what? Why don't we do that? As a Mohawk, why aren't I wearing my Mohawk earrings that I have? And why aren't we doing that more on a regular basis to remind people of the diversity of culture across the country? And there are ways we can exercise who we are and share that information and help people know more about us. So it just was a trigger for me, and I thought, gee, really important to do, people to live your culture and to live your traditions by wearing it. So I think I'm going to be changing how I dress in the future and try to become more cultural. So watch for that. Anyway, according to the Society of Obstetricians and Gynecologists of Canada, they released some studies in 2007 and 2009. And in those studies, they indicated that the highest rates of HPV in Canada are among women and men between the ages of 15 and 24. And the central causal factor of cervical cancer for women is HPV. So this makes it more of a burden for women as a population. Indigenous women around the world, this is another issue that is part of their life and their lifestyle. So it's extremely important, because the women are the caretakers in the communities, and they're the bearers of our children. So I think that's important to take note of. And cervical cancer is the second most common cancer in Canadian women between the ages of 20 and 44. And there are about 1,350 new cases of cervical cancer in Canada every year. So approximately 400 deaths also per year due to cervical cancer. So this is significant disease. It's something we can take preventative action. It's an area where we can take preventative action. So in terms of HPV and First Nations, Inuit and Métis populations, we don't have any information. The screening rates and immunization efforts for First Nations, Inuit, and Métis are unknown, really, and the only information we have come from regional studies. There's no national data, so we have to do something about that. So it's an area that requires future focus. So there's little known knowledge of HPV in First Nations and Inuit and Métis communities, and there's a lack of services and shortage of healthcare providers in remote northern communities. And there's lower screening rates for First Nations, Inuit, and Métis women, and there's little follow-up care. And I think distance in the north is one of the huge factors. And when they do come and follow up, there's negative encounters with healthcare providers who might not have a culturally appropriate manner when working with First Nations, Inuit, Métis women. So communication, language, and cultural appropriate programs and services are needed, and they're lacking. There's funding shortages for trained female First Nations, Inuit, Métis staff. That might be an area that we can focus and do more work in the future. So today, it's a wonderful opportunity to learn about some findings regarding regional cervical cancer and HPV research and surveillance. And so the speakers will be providing that. So I'm absolutely delighted to be here. I think it's extremely important, and thank you for coming. Nyagoa.
Next, we'll be introducing Dr. Sobol, who has accommodated his busy schedule to be here with us today. Dr. Sobol is the Chief Medical Officer of Health for Nunavut, who also holds an appointment as a Clinical Assistant Professor in Family Practice at UBC. He obtained his MD and Family Practice training at Queen's University at Kingston and his Community Medicine training at UBC. Dr. Sobol is the Chair of the Council of the Chief Medical Officers of Health for Canada, the Nunavut representative on the Public Health Network Council, and the Provincial Territorial Co-Chair of the Surveillance and Information Expert Group on Public Health Network, or of the Public Health Network. Additionally, Dr. Sobol sits on the advisory board of the National Collaborating Center on Aboriginal Health and also on the advisory board of the Institute of Aboriginal Health for CIHR. His medical career has focused in the area of Aboriginal health, working with Métis, First Nations, and now Inuit communities. Each year, he also leads a team of volunteers to provide free medical clinics for the poor in eastern Tibet on behalf of Rakpa International, whose Canadian branch he founded in 1992, an initiative for which he will be leaving tomorrow? Sunday. Soon.
Well, thank you for the introduction. Thank you for your initial comments. I'd like to acknowledge that we're on Algonquin territory and pleased to be able to have this forum in that territory. And your comments about connectivity with nature and the past and future health of the planet and human beings related to that is something that is too often forgotten, and I think has led in our materialistic world to the desecration of the planet, which we're all trying to either mitigate against or adapt to. So in that context, we have big challenges as a species, as a nation, as mental, physical, emotional, and spiritual beings. So with that, although HPV is an important topic, let me put it in perspective. It will capture our attention today, but there are many things on our plate. And Colleen, you in your introduction, it sounded like I'm way too busy. Yeah. So let's see, how do I make this go forward? Do I push? Look at that. Okay, that does it. So first of all, I'd like to go the other way.
Is that right?
No, this is the beginning.
Okay.
I started with acknowledgements, yeah. Because although I'm presenting today, and although I'm presenting Nunavut data, the project that led to the results that I'll be discussing was initiated by the Public Health Agency and really, and the NWT had decided to do this type of surveillance work, and Nunavut was invited to join. There was some international polar year funding which allowed this to occur, and we happily joined, and for reasons of expediency, we said this is public health surveillance, it's not a research project. But really, the work was done by the Public Health Agency, and I want to acknowledge that because I'm speaking, but Stephanie could just as well as I have been up here talking about this because she's really been steeped into this work. So Stephanie, you will get a chance to speak later. Would you like to stand up, take a bow? Yeah. There were other contributors to the project from the Public Health Agency: Alberto Severini, Vanessa Galeski, Yang Mao, Gaia Jairaman, Tom Wong, and we certainly express our appreciation to them. Catherine Dinner has been involved. You're here today too. So the Public Health Agency has been very, very supportive of Nunavut's efforts, so thank you so much. So I don't know if all of you know where Nunavut is and what it is. I had to assume that some of you may not. It's quite often that when I speak to Canadians and show them my driver's license, they're completely flabbergasted. They don't know what's going on. So this is from Google Maps. That's Canada. You see the little white line there is the border of Nunavut. I said I wouldn't leave the mic, but I will just for a second. So that's the territory of Nunavut. So Nunavut was established a very short time ago. It's Canada's newest territory. Established in '99, we have a population now, I think it's a little over 31,000. Anybody know the latest census figures before we lose the long form census and we don't know much about anything? I didn't say that. 85% of our population are Inuit. 50% are under age 21, and I think it's just fantastic that Inuktitut and Inuinnaqtun are really used. They're spoken by 80% of the population, and some days when I'm headed to work and I'm feeling discouraged because there's so many problems and so little resources to deal with it, and I just pass by a couple of people speaking in Inuktitut, it makes it all worthwhile.